Millions of Ontarians have not received all their recommended vaccinations. 5 million Ontarians have yet to receive their first booster, and over 1.6 million Ontarians at the highest risk for severe outcomes have not received their second. These individuals are strongly encouraged to do so as soon as possible to protect themselves from severe illness and hospitalization, especially for those that are over 60 years of age. While my call for arms remains the loudest for the most vulnerable in our communities, we've made the decision to expand the eligibility for second boosters to include Ontarians aged from 18 to 59 years of age. Beginning July 14th, individuals in this age group may choose to get a second booster if it has been 5 months since receiving the previous booster dose and at least 3 months after any COVID-19 infection. While we're making this option available, it is important to note that healthy, currently vaccinated individuals continue to have significant persistent protection against severe disease even 6 months after the last dose. However, there may be individuals with personal or medical circumstances in those age groups who may benefit from an additional protection of a second booster. We know that we have persistent and powerful immunity stretching past 6 months in younger and healthier people. So it's not an obligation to get a booster dose if you're young and healthy and have no underlying risk to this virus. We know your risk of hospitalization is low and your level of protection remains relatively constant for that population. So the real call for 18 to 59 years of age is anyone that wasn't in that 60 and over age group with underlying illness, but to please consider coming forward as soon as possible. Another point I want to assure, if Ontarians get a dose, this second booster dose, we will have a minimum separation between the fall dosing and this dose, but it will not interfere with your eligibility for the fall, which is a combined vaccine which may have 2 different strains of COVID-19 in it.
If you're a healthy adult, no underlying conditions, is it okay to wait for that booster?
You can seek independent consideration from your healthcare provider, but if you're young, no underlying medical illness, have had your first 2 doses, so your primary series plus your first booster, I think it's fine to wait at present because your risk of hospitalization and severe outcomes at a population level is very, very low.
This is City News Everywhere.